accept and apply ourselves. So I would say practice is going fairly well. We're managing to work ourselves through these choppy waters.
Okay, I see. And Dr. Rasool, on your side?
Good evening, Dr. Bhikha. Good evening, students. Everything has been going well on our side. We know that COVID definitely affected us initially, but people are now starting to venture out of their homes, and we're seeing more patients, and PPE is up to scratch, so that gives patients peace of mind. And it's good to be back at work, you know, at full speed again.
I see. All right. So I see we still have some. We can, I think, still give it a maybe a few more minutes while we have some more participants join in the session. So far we've got about 25. So I think let's just give it a little bit more time. We also live on Facebook. So I think there are some participants that will have joined on Facebook, but I think let's just give it some time. Dr. Vilakazi, if I may just ask, what do you think of the president's very watered lockdown level 1?
Well, Dr. Bhikha, the president, level 1 has worked for most of us. And I think level 1 for most people is just like everyone can go back to work, just stay safe, take all the precautions, and just make sure you're safe. That's all. But so far, so good.
All right, Joe. I see. Wonderful. And Dr. Nathiram, you think with the new regulations, with some of the regulations quite eased out and traveling bans lifted all over, you think people are going to still be very careless, or what's your take on that?
I think when you look at human nature, you're going to have the few delinquents that will be there. I think what we also have to reassure ourselves is that in the profession of dentistry, before COVID, we are exposed to many forms of viruses and conditions that are highly infectious, for example, TB. And Corona, I believe, is here to stay. But as healthcare professionals, I think we have adapted and applied ourselves well enough to manage these difficult situations. And also kudos to SADA. SADA was the one institute that came up with a fantastic protocol that allowed us to apply ourselves according to the levels of lockdown. So I think, yes, we should expect, as everyone else is expecting, for a surge in infections. But I think as a nation, if we all come together and go into a mutual understanding and appreciation and respect for the virus, I think we should be able to pass through this phase fairly well.
Definitely, I agree. Totally agree with you. So the time is about 5 past. I think maybe we should officially initiate the session. So ladies and gentlemen, once again, those that have just joined us, a warm welcome to you all this evening to the 4th year presentation from all the universities. I hope you guys are doing well. I hope the year is going well for you. I know that this year especially has been a tough one. And this time of the year, it's a crunch time, even as 4th years, I know. When I was in 4th year, I know around about this time, we had the fixed prosthodontic course that was scheduled. That took 1 month of the last quarter of the year. And that was a very stressful time. I know 4th year is a very difficult, it's a very tough year because there's so much of volume, there's so much of workload, there's a lot of examinations, tests, presentations that you guys have to do, and not forgetting the clinical quotas that you have to complete. So I just hope that all of you are doing well and surviving that. And you know what I always say, be positive and everything will work out in the end. So this evening, we're just going to touch on a lot of general aspects. We're going to talk about SADA. We're going to talk about the Young Dentists Council. And the Young Dentists Council is the youth body or the youth wing of the South African Dental Association. And this evening, on our panel, we've got some of the members who are the executive members of the Young Dentists Council. And we have Dr. Sudhir Ratiram, who's the Vice President of the YDC, the Young Dentists Council. And I must also, I always admire Dr. Ratiram for the work that he does in SADA, not only on the youth front, but also he's the president of the KZN branch committee. I'll also talk to you guys about branch committees in the presentation, but he's doing a very good job being a young individual and leading such a big branch. The KZN branch is a very big branch. So good work to you. Dr. Ratiram, do you just want to introduce yourself a little bit?
Thank you, Dr. Bhikha, and thank you so much for that complimentary introduction. I know Diwali is coming, and I'm sure you will be receiving a parcel from KZN.
Thank you.
Good evening to the future dentists of, I'd say, to our future dentists who are going through, as Dr. Bhikha mentioned, a tough time. But remember one thing, when you remove a diamond from the rock, the more refinement that diamond goes through, the more you'll shine. And I'm very confident that the fourth year class of 2020 would be outstanding, shining dental practitioners once they qualify. So thank you, Dr. Bhikha, for that introduction. And thank you to the young fellow future dentists for joining us this evening.
Thank you, Dr. Ratiram. Thank you so much. We also have our secretary, the YDC secretary, Dr. Sadia Rasool. She's also a very enthusiastic member. And Dr. Rasool, would you like to say a few words about yourself? Just introduce yourself to the session.
As Dr. Bhikha mentioned, I'm the YDC secretary. And it's an honor to be part of the YDC and an honor to be part of this Zoom meeting and to be part of the panel addressing the youth. I still count as youth as well, but I mean, dental students, I feel like it was just yesterday where I was in that position, and I can understand the amount of stress and emotions that you guys are going through and have been going through. I mean, fourth year, like Dr. Bhikha mentioned, is not easy. And Dr. Ratiram mentioned this refinement and polishing will definitely help you deal with future stresses. Fourth year is definitely hectic with exams, quotas. I think we wrote 21 papers when I was in fourth year. And all I can say is that it does get better. And fifth year, once you're done with these papers, it's like something just comes together and all of that theory somehow meets the practical aspect and it just starts to make sense. You can see a patient holistically and you're able to apply everything that you've learned. So it's all in the process and it's going to be okay. I know right now you guys feel like, what's happening? Will we ever be done? Will we pass? And you will. Just put in that hard work and trust that it will be okay. Yeah, so that's all from me.
Thank you, Dr. Rasool. And then we've got another member of the YDC, Dr. Charmaine Vilakazi, also a very enthusiastic member, always ready to join a session when I ask. So, Dr. Vilakazi, will you just introduce yourself and say a few words about yourself?
Thank you, Dr. Bhikha. Good evening to everyone. Good evening to the fourth years, my future colleagues, everyone's future colleagues. My name is Dr. Vilakazi, as Dr. Bhikha has said. I'm an independent practitioner currently, and just like you guys, I was a fourth year who was scared of I will never finish quota, exams are here. How do I study? How do I juggle everything? But just know that it will pass, especially with you guys going through the COVID-19 phase, having to change a lot, like with the schedule, but at the end, it's all worth it, and you will learn how to juggle everything, and it will gel. So yeah, thank you, Dr. Bhikha.
Thank you, Charmaine. Thank you to our team. So, ladies and gentlemen, before I start, I just would like to make a few announcements. So this evening session is being live streamed on Facebook. So those participants who are here, if they would like to send the South African, would like to mention to their other colleagues in their class that they can join via the Facebook page, and that's the South African Dental Association page or the Young Dentist Council page. So it will be broadcast on those pages. We do have some upcoming events That is next week, which is the 17th. We've got a men's health evening. It's a special program. And then on the 19th, we've got another YDC presentation evening by Dr. Buleni. She's a very young, enthusiastic dentist. She's on the front line of dentistry, making amazing things happen. So please join. These sessions are absolutely free, and you will learn a lot. Dr. Buleni's session is going to be very practical, so you will learn a lot of tips and skills from her session. Also, you're more than, at the end of the session, we'll be taking some questions. So you're more than welcome to ask some questions or offer your comments. And you can just do that by typing it in the Q&A section of the Zoom program. Avoid using the chat function, rather use the Q&A section. I'm just going to share my screen and then we will get going in a few. Dr. Ratiram, just a confirmation, can you see my shared screen?
Yes, Dr. Bhikha, I can see your screen
All right,
quite clearly.
Wonderful, thank you. So I just want to also just mention that one of our SADA representatives here, who is Dr. Nthabiseng Metsing, who is the head of the professional development at SADA, was actually supposed to do the session. So I'm doing the session on behalf of her, but she just would like to convey her good wishes to everybody and all the best. And this presentation, a lot was prepared by her, and I've also done some. So I also have to give credit to her for this presentation. So that's Dr. Nthabiseng Metsing's name and surname, and she heads the professional development. I forgot to introduce myself. I am Vishal. I know some of you may have seen me on the SADA pages, and I'm the president of the Young Dentist Council, and we do a lot of work with the young dentists in our community and in South Africa. And we try to uplift the young dentists in South Africa, as well as the students. We engage with the final year students and the community service students. So currently, I am in the public sector, and my work towards SADA is due to purpose and passion, as I would say. So, ladies and gentlemen, welcome again. So, in order to know where we are in present, a lot of us like to look back where we came from. It is very important to know our history. So I know all of you are focusing on dentistry, you know about composites, you know about veneers, and you know about CEREC machines and things like that. But I'm just going to do something different and take you one step back, or maybe a few steps back. So where did dentistry start from? What's the origins of dentistry? If we see tooth decay actually has roots, well, no pun intended, but tooth decay has roots from the pre-agricultural societies. So back in the day, and dates back to the farming era about 10,000 years ago. And as the farming, the agricultural aspects, activities increased, people noticed that there was increase in tooth decay. And as we can see, that even from as far back as 130,000 years ago, there were Neanderthals that already used rudimentary dentistry tools. If we move more modern, which is 7,000 years ago, there was already evidence that the Indus Valley showed that yielded evidence of dentistry being practiced as far back as 7,000 BC. Then we move to the first restorative treatment. The earliest dental fillings were made out of beeswax, funny enough. And this was discovered in Slovenia and dates back about 6,500 years ago. So you can see that as we're moving along, there's been small advances in dentistry. And dentistry was also practiced in prehistoric Malta. And there was evidence that where they found skulls that had abscesses from a root of a tooth dating back about 2,500 years ago. Then we move a little bit more closer to time, and which is the 14th century AD. And we can see that in ancient, the Sumerian time, it describes dental decay as caused by the dental worm, the tooth worm. And I'm sure many of you heard that was a theory that many people thought that when you're experiencing tooth pain, it's that worm inside your tooth that's busy moving and trying to crawl out. So as we can see, we move along and we see how dentistry is starting to evolve. Then we move on to an era about the 1978. So Foucault was the pioneer of dental prosthesis, and he discovered many methods on how to replace lost teeth. He also suggested that substitutes could be made from carved blocks, ivory, or bone. He also introduced dental braces. Although they were initially made of gold, he discovered that teeth position could be corrected as teeth would follow the pattern of the wires. Waxed linen or silk threads were used to employ or fasten these braces. His contribution to the world of dental science consists primarily of his 1728 publication, The Surgeon Dentist. I'm sure some of you would know that historically, they were known as dental barbers or surgeon barbers. And then moving on, the French also included basic oral anatomy and function, dental construction, and various operative and restorative techniques. And now we're moving on to a very dynamic era. So major advances were made in the 19th century, and dentistry evolved from a trade to a profession. And many of us can vouch for that yes, dentistry is there to help people, it's there as a service, but many people also focus on the business of dentistry. Then the profession came under government regulation at the end of 19th century. And in 1878, there was an official British Dental Association formed in 1879. In that same year, Francis Brodie was the first dentist to become elected as the president of the Royal College of Surgeons. So as you can see, this is how dentistry is evolving. And now we're in the fourth industrial revolution, or many of us already say we're in the fourth industrial revolution. Some of us say that it's still busy coming. And here we can see in these diagrams, in these pictures, that it is illustrated. It looks like 3D printing, various scanners, So it's amazing new technology, such as virtual or augmented reality, 3D printing. And these things are the future of dentistry. I know today SMU hosted the IDR conference, which is the International Association of Dental Research. And already the initial aspects of this conference focused on the fourth industrial revolution and how we are moving towards this. And we need to keep up with the times, that this is the future of dentistry. Yes, we do not need to forget about the basics, and the basics will always be key, but take the basics, evolve it, and there we can create a new face for dentistry. And now often when I've spoken about this evolution of dentistry. Now let's move on to the public perception. What is perception? As you can see from that picture at the top there that I've placed, it is a perception that some people think that the earth is flat, some people think the earth is round. But yes, there is fact to that, but a lot is based on perception. And how is perception perceived, if I may ask? And that is the experiences that one has. So we often say that one of the most common childhood nightmares is going to the dentist. Who would not understand that? I'm sure all of you had some experience of came across a patient that is absolutely petrified by going to the dentist. It's a total experience that you have to sit in this huge chair There's this massive light above your head. You have to endure somebody looking inside that's poking around in your mouth, using frightening devices, and then who's telling you not to eat your favorite sweets, you can't drink your favorite cold drinks, you need to brush your teeth regularly, and these memories stick. If I can share an experience with you, I was once treating a 70-year-old patient who was absolutely petrified of coming to the dentist. And talking to him, going back, he explained that, you know what, when he was a child, his parents took him to the dentist and he had the most terrible experience. And that stuck with him all his life. So these things make a big difference in our life. So first, we talk about how dentistry evolved. Now we're talking about how our perception towards dentistry is taking place. And that also is an evolving aspect. We need to start becoming more humble. We need to start understanding who's sitting on the chair. What are they going through? So no one likes going to the dentist, in spite of the fact that everyone knows how crucial oral health is and how strongly it is connected to our overall health. And look at that picture. That picture, I think, is purely of perception. Our drill is a very small drill, but I feel that, you know what, that's how the patient perceives it, you know, as this massive drill being bored into our teeth. Now, let's move on to what we want to discuss tonight. Where does SADA fit into play? The South African Dental Association. And that's why I put this picture here, specifically so that you can see. So there's a family, it's raining, there's it's bad weather, and then there's a leader holding, or the tallest member of the family holding the umbrella. And I feel that is a very symbolic picture. That describes SADA in a nutshell. That yes, we need to be, the dental profession needs to be, we all need to be under one umbrella. We cannot be scattered. We are a small profession compared to a lot of other professions. And we need to be united as a family. So under one umbrella, and especially during tough days, tough times, tough years such as 2020. Absolutely, it was not raining, but storming, if we look figuratively at the year. So that's why we need to stick together and we need to be under this umbrella. So SADA, the leading professional industry membership body for dentistry in Southern Africa since 1998. The South African Dental Association represents majority of registered dentists in the country's private and public sectors. So membership is open to industry professionals from dental schools, which is free from first to final year. And we are open to retired dentists as well. A lot of times we fail to understand that. We think that as students, we need to have a special membership and that it will cost us something. But today I'm here to tell you that membership for students is absolutely free. So why not go out and enjoy the benefits of having a free membership? Even your CPD events will be free if you're a student. This year, SADA has had so many CPD events for free, and they're there for you. They're there for you guys to learn, to engage, you know, to share, to develop yourselves, develop your skills. And therefore, the association is committed and engaged in process of relating to setting industry standards and formulating policies. I will also talk later about national health. So whether you know it or you don't know it, whether you like it or you don't like it, SADA is there in the background, fighting and working and managing the progress of dentistry. Whether it be codes, whether it's policies, you may not even know that there are policies that were created by SADA that govern the dental profession for the benefit, for your benefit. You may not know it, but that's what we are doing there. We're constantly in the background working for the dental profession. And therefore, the vision of SADA is to be recognized as a trusted leader and voice of oral health care in Southern Africa. And if I may add, we are probably not only the leaders, the dental leader body in South Africa, but maybe more so in Africa. When we have our congresses, our annual congresses, we see people coming from all over Africa just to attend our dental congress. Moving on to the mission. The mission is to promote the interests and to serve the needs of our members, and above all, encourage optimal oral healthcare for all South Africans. So that is just SADA in a nutshell. If you wish to visit the website, read more about that. I don't want to expand too much on the nitty-gritty. So that's in a nutshell. We are there for you. All you need to do is remember that picture, and that's who we are. We're there for you to hold the umbrella. We are one family. Whether it's good days or bad days, we are there for you. Now, moving on to the Young Dentist Council, which I think is very relevant to you guys as well. Even this year, we've been engaging a lot with the final year dental students. We've been really engaging with the community service dentists, because these are the young people. You'd always look at maybe the older guys, the guys who are well established, the guys that are driving these fancy cars, and you think to yourself, really, when am I going to get there? How am I going to get there? Is that the real face of dentistry? So we think to ourselves. So that's why, to bridge that gap between those guys and from student, is the Young Dentist Council. So the Young Dentist Council is the organization working under the mandate of the South African Dental Association. The YDC was launched in 2013 with the aim of connecting younger members and providing them with an enabling environment where they can debate and deliberate on matters affecting their careers and the dental profession. Do you want a future that is bright as a dental light, or even brighter? Whether you're a dental candidate student, or you're doing your community service here, or a dentist in the public service, or even in the private sector, about under the age of 35, you are eligible to join the Young Dentist Council. This is a platform designed to develop and nurture future leaders in the dental profession. Today, the YDC is an enthusiastic, committed, and concerned group of young dentists working together to nurture a brighter, more sustainable future. And we're there for you. We're there to help guide you. We're there to answer all your questions. It was amazing that already this year, towards the end of the year, I started getting a lot of, how can I say, arising matters from the community service dentists, concerned about their future jobs. And we did a session with the community service dentists about a way forward, what they need to look at, what they need to consider, what the next steps they can take. So we're there for you. We also engaged with the final year students. And again, we're going to have another session with the final year students next week. So why SADA? Why the YDC? With its mandate of a brighter future for all, the YDC provides mentorship, support, and advice during your student years, your ComServe, and thereafter. It increases the public standing of young dentists among external individuals and organizations. We organize educational events at SADA branches. So if I may add, I will add also a bit later that we have various branches around the country, meaning the mother body has various branches. And each branch has a YDC member. So you can get in touch with these members, or these members at the branch level help to develop the dentists in their society, in their community, in their region. So therefore, it is very important to have these young members that serve on branches. We also facilitate networking with peers, seasoned professionals, and industry experts. We also offer clinical refreshers at reasonable or subsidized fees to post-com service dentists, and we conduct surveys to determine future courses. If you look at our Facebook pages, the YDC page, you will see there's some interviews that were conducted with some leaders in dentistry, and we spoke to them on the aspects of mentorship, the importance of mentorship. Why should we have mentors in dentistry? Why do we need to have these people who we can look up to? If you look, we also did an interview with the very popular Dr. Smile, and he also gave young dentists so good advice on how to develop yourself, being a student, being a ComServe, or being a young dentist. And look at this pic that's depicted here. Everybody's happy, everybody's holding hands. We're a diverse group, we need to be united. We also offer mentorship, as I've mentioned, to manage expectations. Because once you're in the real world, it's a different world, and it is also a difficult world. I won't say it's not a walk in the park. There's a lot of new changes, there's a lot of expectation. So we give young dentists also the voice for structural changes in the industry. If you feel you have a voice and you want to voice your opinions, your suggestions, talk to us. We are there for you. We also promote the interests of young dentists by lobbying and advocating on their behalf. We also liaise with committees and councils, medical aids, the Health Professional Council of South Africa, on matters such as globally benchmark remuneration as well. We provide resources for professional development, communication on various levels. We support private dentists with advice who have just recently opened up their new practices. And therefore, if you have any legal aspects that you are considered about, maybe not now, but maybe in 2 years' time, something for you to consider that when you're opening your practice, that SADA is the platform there that you can come and ask. We have the service where you can ask for advice, you pick up the phone, speak to our legal advisor, and they can guide you on policies, on new practices, whether you want to sign a contract with somebody, we're there to guide you. We're there to guide you on partnerships as well, if you're planning on doing a partnership practice. And therefore, we bridge the divide between thinking, understanding, and the needs of the next generation of dentists and those of our forebearers. These are just some of the members of the YDC. We do have some new elected members. Some members have stepped down due to other commitments. But this is some of the members of the YDC, a very enthusiastic, a very jovial, a very enthusiastic bunch of dentists. And not forgetting the public sector. We often think of SADA as just being in the private sector. But with more than 90% of South African dentists working in in those sectors and only treating 16% of the population, those who are covered by more of the health insurance. And therefore, we're going to look at the aspects of national health insurance as well. And unfortunately, the public sector is under immense pressure. Sometimes in many areas, it is ill-equipped when it comes to oral and dental health care. Therefore, and that side, when we look into the public sector, largely the focus is on extractions, more than restorative procedures, let alone preventative support. And this was according to a research, or according to Dr. Nirvana Nurjan, who was heading the coding and nomenclature at the South African Dental Association. She did a lot of work on the public sector and the private sectors, our costing, our billing. So you see, SADA is constantly focusing on making the environment, the dental environment, better for its members. As I mentioned, yes, some people hate this. Some people think it's good. Some people have mixed emotions. Some people are sitting on the fence when it comes to the NHI bill. What you must remember that the NHI bill is a theory whereby it will benefit the public and the population at large. And SADA is in constant engagement with the higher authorities, with the minister and his team on the implementation of national health insurance. Where we need to fight, we fight. Where we need to support, we support. But always keeping the benefit of our members at heart. So maybe it won't affect you now, But these things are just something to keep in mind. The National Health Insurance is a financing system that will make sure that all citizens of South Africa are provided with essential health care, regardless of their employment status and ability to make a direct monetary contribution to the NHI fund. The majority of South African dentists are growing increasingly concerned about the impact that the National Health Insurance and other industry developments will have on the future of their profession, according to the results of a new survey conducted by PPS. So a survey of more than 150 South African dentists revealed that 47% are concerned about the prospects of earning a sufficient income should the NHI be implemented. As I mentioned, that many people have mixed emotions about it. Furthermore, when asked about the confidence in the future of the profession, only 23% of local dentists would encourage their children to enter the profession. Now, would you recommend your kids, would you recommend matrics or young individuals that are still at school choosing careers, would you advise them to go about and take dentistry? And I can read some of your minds. Some of you guys are saying no because you're currently in hell. But I think you should change your mindset about that. We are the only people that can make the difference in dentistry. You can make it better and you can advise someone to choose dentistry. So according to the head of the marketing and stakeholder relations at PPS, the financial services provider focused on graduate professionals. The survey results indicate that South African dentists are highly concerned about the future of the profession in the country, given the numerous developments and challenges facing in the oral health industry already. 47% of dentists did not agree with the principle of NHI, while 89% of dentists feel that NHI is not the solution to fix the country's ailing health system. So that's something to keep at the back of your mind. We should always, if there's a system that's going to benefit the public, that's going to benefit the population, we are in a profession where we are not only there to think about our profession, we are there to serve. We have taken a Hippocratic oath to help people as well. I'm not saying only, but I'm saying as well. So therefore, the health of public should also be a concern for us. But yes, SADA is in constant engagement with the developers of the NHI. We are in constant engagement with the Health Department, Department of Health, and the Minister. So these are just some things to keep in mind. And now the state of the private sector. Results from a survey done by PPS reveal that 94% of dentists believe that medical schemes do not provide adequately for oral health. Now you'll know that, or maybe you've heard from some senior colleagues or some family members that are dentists that, or maybe your own dentist, that medical aids give them such a headache and, it's such a mission dealing with medical aids. So that's also another aspect you keep in mind. And that SADA is constantly engaging. We have a special medical aid committee that deals on a daily basis with medical aids and trying to negotiate always better deals, better pricing for our members. And it's not only the members at the end of the day that benefit, but it's everybody. Now, just moving on to the aspect of CPD. What is CPD? So CPD is continuing professional development. This is another powerful aspect in which SADA stands for as well. So once you qualify as a dentist, the learning does not stop there. The education does not stop there. On a constant basis, on a routinely basis, you have to keep developing your skills, keep developing your knowledge. You have to keep up to date with the latest trends, what's happening. You need to know what's happening around you. You need to know the developments in dentistry. You need to know about the latest research that's out there. And as I mentioned to you, that look, even today at the IADR conference, which is internationally recognized, it's so proud. It's a proud aspect to see that there's so many South African dentists in academic and private, in public settings that have come out and are doing research. They're presenting their research. And this is, you know, to make the dental profession a better place. It's this evolving knowledge that will help us. So healthcare practitioners have a responsibility to continually update their professional knowledge and skills to end for the benefit of patient and client. So at the end of the day, it's not only you that benefit, but it's also your patients that benefit from the aspect that you are continually learning. And to this end, the HPCSA has implemented a continuing professional development program, which is called CPD. Every practitioner is required to accumulate 30 continuing education units, CEUs, also known, for a 12-month period, and 5 units must be on ethics, human rights, or medical law. Each CEU will be valid for 24 months from the date on which the activity took place or ended in an event of postgraduate studies. So during your community service here, you do not require to formally get these points, but you are always encouraged to continue learning, continue attending courses, continue attending webinars whereby you'll be learning. And what also happens is mandatory random audits are conducted to ensure this compliancy. So don't just think that, oh no, I can get away without learning and attending these. HPCSA, when they find you, they will hunt you down and they will question you. So yeah, and SADA stands very strongly for CPD, because SADA is one of the groups or institutions that is appointed by the professional board of the HPCSA, the HPCSA CPD committee, to be both an accreditor and a provider. So here we are providing CPD points through our webinars, pre-COVID or pre-lockdown. The main form of our CPD platform was events. So each branch would host events, we'd get together, we would meet people, there would be a speaker, and a CPD session would be delivered on a specific topic and interesting area of dentistry, and you'd get your CPD points through that. Now we are moving more to the webinar aspect, where you can get your points by attending these webinars. You can also get your CPD points by subscribing to the South African Dental Journal. And you know what? There's more than once you are a SADA member, there's a plethora of ways in which you can attain your CPD points. There's no need to go to search for CPD points from extra sources. It's all under this umbrella. And if you look, this is some of the events that we used to have, the branch events. Also, sometimes we have full day events where from the morning till evening, you are trained in different areas, different topics. We have some practical sessions where, for example, I know a very popular practical CPD event that we have is our endo and our rotary courses. There's also some implant. We also offer sometimes with Dr. Mark Bowes, the digital smile design courses at a discounted rate. So you know what? There's enough benefit. You can learn. That's what you're there for. You need to learn. Take what you can get. And also, there's questionnaires, there's journals that are in the South African Dental Journal. There's articles. You can answer those questionnaires, submit it, and you can get your points there, and you're learning at the same time. The YDC is also soon going to start a platform, which is a journal club. I know Dr. Ratiram had initiated a session whereby there were case presentations discussed on an evening. And I mean, that is such a wonderful way which you can engage with people, ask questions, give your inputs on these areas of dentistry. SADA also engages in a lot of outreach activity. You can see this was on World Oral Health Day in 2019. We also had World Oral Health Day celebrations in 2020 but because of the restrictions, celebrations were cut down a bit. But this is an outreach event that we went to. It was at the Nelson Mandela Children's Hospital. We can see even the Minister of Health, Dr. Zweli Mkhize, joined us at that event. And it's so nice to engage with colleagues to explore a new setting of dentistry, to give back to the community. So we're always looking for volunteers. I know sometimes there's always people willing to give their services, but they don't have a platform. And here there's a platform. SADA is offering you a platform. When we need you, we'll call you and you can offer your services. You can bring some dental materials and some instruments and have a wonderful charity or an outreach event. This year on World Oral Health Day, we were at Sharpeville and we saw close to 1,000 school children. It was a full day event. We taught them oral hygiene techniques, dental education, and it was a wonderful event. This was at the universities where some of our YDC members, and there in that picture we can see Dr. Vilakazi, who's joined us this evening, who's the panelist, that she's engaging with the students at the university on World Oral Health Day. There's some more pictures. So ladies and gentlemen, I want you to emphasize a lot on this aspect. I think the boring stuff has been said. So now you guys are young individuals. You guys are dynamic individuals. You're moving forward in dentistry. You guys are at the right time where a lot of the technology advancements are taking place. And therefore, that's one thing that I wanted to emphasize today, is that using social media and technology to your advantage. With the use of Facebook, Instagram, YouTube, WhatsApp, all of these are social media platforms. And it's not just to upload pretty pictures of you on a holiday on the beach or selfies with your friends, but more so, yes, do that by all means. I enjoy people who do that as well. But use these platforms as a way to learn. Use these platforms as a way to engage, and use these platforms as a way to develop yourself. I mean, on Instagram, if you go and you follow dental pages, you can learn so much. There's dentists doing webinars, or not so webinars, but live Instagram sessions on Instagram. They're doing interviews. There's international pages, and in the comfort of your home, in the comfort of your free time, go and explore these. Also on Facebook, there's so many dental pages. Go and visit international pages. You can learn a trick or two. On YouTube, if you don't understand something, go and YouTube a procedure. Go and YouTube how to do something. Even you can learn how to do, I'll give you an example. There was a certain procedure I was doing at the surgery maybe about a month ago on how to wire a patient in a certain way using a splint called Eric splint. Maybe you guys are not familiar, maybe some of you may know. And I wasn't totally sure on how to go about this. I YouTubed videos and wow, it gave me plenty of videos. And the next day, my senior dentist, under his guidance, we did that and it was perfect. Even WhatsApp, you can learn so much on WhatsApp. Just recently or this week, there was a dentist on one of the dental WhatsApp groups that said that he wants to use WhatsApp as the platform to engage with people, to share his clinical pictures and, you know, teach young dentists about certain aspects of dentistry. Also, it's not only about learning, but also about developing yourself. You will see many people put up their clinical pictures, that too, I must emphasize, with guidelines, the correct guidelines. Go up there, create an educational platform. If you guys are creative, create an educational platform whereby you can upload clinical pictures, ask questions, get people on board, and you can create your dental portfolio. It might sound so bizarre, but nowadays you can even put your Instagram and Facebook handle on your CV. And sometimes some people, some interviewers, they can pick this up. I'm going to tell you about an incident about what happened to somebody. They had the Instagram handle on the educational Instagram handle on their CV. And while he was in the interview, one of the other interviewers in the panel went onto his Instagram and went to search for this guy. He just had a look at that guy's CV, he looked, and the next question was based on his Instagram handle. And it quite shocked him that it's amazing that they look at these things. But look, sometimes it can happen, it can benefit you. It can separate someone when applying for a job. It can be to your advantage that you created a platform, an educational platform of learning. Sorry. So I want you to use these platforms whereby you can learn and teach. And when it comes to guidelines about what to post, what not to post, there are many people who you can ask. If I may, with no advertising to anybody, yet again, I'm going to use the example of Dr. Smile, Dr. Lexley, or Dr. Rawani. He does a lot of teaching on the regulations of what you can post and not post on Instagram. So some of you guys who are from WITS, who's attending, I know he does lecture there. So get in touch with him. I know at SMU, Dr. Kani Makwakwa also deals with a lot of these aspects. Speak to her, get in touch with people, or phone SADA, their legal advisor can advise you on these aspects. So ladies and gentlemen, I don't want to take too much more of the time. This is my final advice to you guys in fourth year. You're approaching the final year, you're approaching the final stretch. While you are young, work hard. Yes, I know people say work smart and work effectively, work efficiently, but at the end of the day, it all boils down to hard work. I know it's been a tough year. Dentistry is a tough degree. I know they have been there, not so long ago even. But it's the hard work that will get you through. Always have your intentions as positive, whether it's treating your patients, speaking to your lecturers, your colleagues. Always have positive intentions, and positive actions will materialize from positive intentions. Ladies and gentlemen, reduce procrastination. If there's something that you can do today, do today. I know it's called student syndrome that we like to leave things to last minute, but try and reduce. Hence, I put the word reduce. I didn't say stop procrastination, because I know, I understand students. I am still a student myself in postgrad. So reduce procrastination. I want you guys to set goals and start visualizing. I know there's time that comes where we feel down, we feel sad, we feel demotivated, but set goals. Let your goals motivate you and start visualizing those goals. And I know dentistry is stressful, it's tough, but I want you guys to give yourself some reset time as well. On a weekend, do something, do a small activity in your routine, like listen to some music, you know, that can calm you down. If you enjoy dancing, dance. I mean, after a tough day, or, you know, if you want to de-stress, put some loud music in your room and just jump up and down and, you know, nod your head and dance. Some of you guys like nature activities, go hiking. If some of you guys want to do some more relaxation type of thing, do some meditation, relax. You need to give yourself reset time, because burnout is a reality. So I want you to give yourself some time to reset as well. Hard work, yes, but also you need the time to reset. And then also reward yourself for the little things. It's not only that you need to graduate dentistry with a cum laude. No, it's not that. The rewards are also small little things. If you made a patient smile, that's a reward. Thank yourself for that. Give yourself a pat on the back. Give yourself a round of applause for that. So reward yourself for small things. If it's a beautiful composite that you did on a patient on a class 2, sometimes that can be, you know, it can give you a good feeling. So you know what? Thank yourself for that, you know? Yeah. Say you did well. Say to yourself, you did well today. And then develop a passion for what you are doing. If you don't enjoy what you are doing, then I'm sorry, you know, you need to develop a passion for what you are doing. And that's why I started off by saying passion and purpose, that I enjoy talking to young people. I enjoy engaging in dental activities and reaching out to young dentists. So, ladies and gentlemen, that's basically the end of our slides of my presentation. And you can contact us. There's the SADA office number. You can also find us on the website. You can find us on Facebook, on Instagram. There's even a South African Dental Association YouTube channel. So if you want to go scan through that YouTube channel, there's a lot of the new webinars that were recorded during the sessions, and they've been uploaded on the YouTube sessions. So yeah, go there, discover it. If you want, you feel free to ask any questions. So ladies and gentlemen, we've come to the end of tonight's session. But before we end, some of the YDC members, I would like them to also give their experiences, give their, what's their take on dentistry. I think I spoke enough. And in the meantime, students, if you have any questions, type your questions in the Q&A tab in the bottom, and I will have a look at those questions. First up, I just want to call up Dr. Sudhir Ratiram. Dr. Ratiram, who is the Vice President of the YDC and also heads up the KZN branch committee. Dr. Ratiram, in brief, share your experience so far. I know I admire your growth in SADA, your engagement with dentists, yet again, I say. Share your experience. I know it's a hard life out there, but do you smile sometimes at the end of the day and say that, yes, I've made it. It was a tough time, but yeah, I'm smiling.
Thank you, Dr. Bhikha. Thank you for that informative lecture as well. It was quite interesting to know the history of dentistry. Some days we might feel on the Monday, we might be sitting in that Neanderthal phase as well, especially early on the Monday morning. Just to give you guys a bit of a background, when you look at yourselves in being in your 4th year, right? Think of when you were in grade 11. Some guys might refer to as standard 9. That's the same level that you are at right now. And when you were in grade 11, that was the time when you started to plan and prepare yourself for post-secondary school. And that was the time when most of you guys who are present tonight were very much passionate about getting into the profession of oral healthcare. I'm pretty sure of that. So that is how you should approach your 4th year. You approach your 4th year looking ahead towards your 5th year as your short-term goal, but your medium and long-term goal is within the profession of dentistry. When I graduated, and I graduated from Medunsa, which is now known as SMU, which I sometimes pronounce it as SMU. So when I graduated from SMU, and I completed my community service in the year of 2013, I literally took a diving board and plunged into the private practice of dentistry, and I launched my own practice. It was a trial, it was a difficult period, especially when there was a lack of business insight into the business of dentistry. A lot of us, when we come out from university, trust me, you are skilled in the clinical aspect of dentistry. Believe it or not, all those protocols, all those systems that you are taught at university level will carry you through into your practice. And that is very important. Don't forget that. Your basics are very, very important. And when I got into the opening my own practice, yes, I went through a few hurdles, right? And I learned as I went through those hurdles. Just think of the difficulty and challenges that you face are like little mountains that once you climb that mountain and you're on the top of that mountain, you feel that sense of accomplishment. And the great thing about being a member of SADA, and as Dr. Bhikha has previously mentioned, SADA is literally a family. It is that umbrella body that is there to support and to guide you along. And it's not just there for CPD events. And believe it or not, the learning never ends. The day when you stop learning is the day when you start living in the past. And CPD events are there, and it's important to follow through with CPD events, but it's also an association that's very much family orientated. When you have a difficulty, when you have an issue, right now as a student, when you have a problem, you would very quickly pick up the phone or go onto your WhatsApp and just contact one of your friends for some form of assistance, especially those late nights to early morning study sessions. Think of SADA as being that friend. When you are having that difficulty or you're having a hurdle that you need to overcome, SADA is there to support and guide you. And when it comes to the YDC, we are the voice of the young dentist. Being young practitioners, we have unique needs. We face unique challenges. And as a YDC, we are there to address that for you. Yes, as Dr. Bhikha has mentioned, we welcome your engagement. We welcome your assistance as well. We are a team, and as a team, we work together. So I thank you guys once again for availing yourselves tonight and sacrificing your Thursday evening listening to us. But I wish and hope to see you guys in the near future. Thank you, Dr. Bhikha.
Thank you. Thank you, Dr. Ratiram, for those very encouraging words and sharing your experience. Dr. Vilakazi, I know we are a little bit pressed for time, but Dr. Vilakazi, would you just say a few words? Would you just like to share your experience?
Thank you, Dr. Bhikha. I would like to actually just share advice to the fourth years. What I've learned as a dentist is drive you in the right direction to core profession. If you don't have the passion for it, you're not going to make it. So as a fourth year student, whatever you do at the varsity, if you're going to take shortcuts, it's not going to work for you. So do the right things right there, right where it starts. Then once you out in the world, then you're just going to be okay, and you're not going to go through what you hear people say they go through. So do your best right now, do the right job. When you do the class 2, make sure that it's a perfect class 2. Don't make it into a class 10 that no one has heard of. So just do your best and everything will just gel at the end. Thank you, Dr. Bhikha.
Thank you. Thank you, Dr. Vilakazi. Dr. Rasool, if you would just briefly want to just share a few words of motivation to the fourth years.
Thanks, Dr. B. The YDC started in 2018 as a supplement.
Dr. Rasool, can you speak up, or is your mic mute?
Can you hear me?
Yes.
And from there, it's really just been incredible networking opportunity. And the YDC has always helped bring about change. It also stands for structural changes and
I think, Dr. Rasool, I think there's an issue with your sound. I don't know. Dr. Rasool, can you say something? Okay.
Can you hear me?
Yes, but very faintly.
Hello.
Yes, yes.
Okay, let me put my... Okay, can you hear me better now?
Yes, yes, you can speak.
Okay, so my journey started with the YDC in 2018.
Dr. Rasool, I apologize. I think we are having a bit of connection issues with you. because we're struggling to hear your audio. So
Can you
if
hear
you
me?
don't mind, I would like to end the session. And so, ladies and gentlemen, we've come to the end of our session, and I wish you all the best for the rest of the year. I wish you all the best for next year, and I will be engaging with you guys and maybe your class reps next year. So, ladies and gentlemen, we close the session now. Thank you for joining us, and good night. God bless, and hope to see you guys soon. Yes, and yeah, all the best. Okay,
Good night.
take care. Bye-bye.
Thank you, everybody. I'm going to end the session now. Have a good evening.
Thank you, Marlies. Thank you, guys.
Thank you.
Good night. God bless.
Night.